we will start another topic in epidemiology of animal diseases, and that we will deal with this time the study about the methods for disease control and eradication in animals. So, what methods we can adopt in order to control a disease in animal population. So, for this, first of all, we should know what is a disease control, what it means that a disease is being controlled. It is in simple word you can say it is the reduction in the morbidity and mortality from a disease. If you take some strategy, if you adopt some strategy which can reduce the morbidity and mortality among animal population, this we call it as disease control. This can also be achieved by treating the animal disease in particular. So treating it by treating animal disease individually, we can also go for control of disease. It means control strategies are those strategies which can be adopted after a disease has happened in a population. That is more important. So before occurrence of disease in a population, uh, the strategies adopted are not controlled. With those strategies which are adopted before occurrence of disease in a population, they are called preventive strategies. So this is the difference between prevention and control. Prevention are those strategies which are adopted before occurrence of disease in the population, whereas control are those strategies which are adopted after the occurrence of disease in a population. That is the basic difference between control and prevention. Now, the second term you might have heard this also, that is called eradication. So, eradication they have different definitions that was given at different uh, by different scientists at different particular time. So it was first used. This term was first used, and it was used to mean that there is a complete extension of infectious agent. Then only we can say the disease is eradicated. So that time it was assumed that if a disease is or if an infectious agent is completely eliminated from the universe, then we can say it as eradication. But this was very difficult to eliminate the infectious agent completely from the this earth. So as per this definition, you can say that there are very few diseases that has been eradicated, like smallpox. In case of human, it was eradicated. It is eradicated disease, and the infectious agent is no more on this planet, except in some authorized laboratory. So this was the definition. It was used to understand the eradication, but this is not nowadays used as a definition for eradication of disease. Later on, this was also defined as the reduction of infectious agent or infectious disease prevalence in a specific area to such a level that transmission cannot take place. So this was that definition was modified, and this was defined that we can define eradication when an infectious disease is eliminated at a very low level at which the disease agent cannot be transmitted. So that is also called eradication. Later on, this was also modified. This definition was also modified and it was redefined as as a reduction of the infectious agent or infectious disease prevalence to a level at which the disease ceases to be a major public health problem. It means if we adopt some strategy to control to eradicate the disease, and by those strategies, if we reduce the prevalence of the disease to such a level that it cannot cause a major public health hazard or major public health havoc in a population, then we can call it eradicated disease, stage of eradication. Though some transmission may still take place. So, as this definition, you can say that transmission may take place, but at very, very low scale. And the prevalence of disease or the occurrence of disease cannot cause a major public health problem. Then these conditions can be defined as eradicated disease condition. Means the disease is eradicated, we can say. So again, this involves a term called elimination of disease. So as you see, this eradication and elimination, they are all more or less similar. They have some relative meaning. And elimination, we can say that reduction in the prevalence of clinical disease. This is important. That is the reduction in the clinical disease or infection below that which is achieved by control, but without complete eradication of the pathogen. It means we can reduce the prevalence to such a level which is lower than the level as achieved by controlling. So we have learned the definition of control. Okay. So control is nothing but those strategies which can reduce the mortality and morbidity. So by elimination, we mean to say that these strategies can reduce the prevalence of disease below the level of control. So by adopting control strategy, we can reduce the disease up to a certain level. So by adopting elimination, we have to reduce the level below the level which is achieved by control. That is the definition of elimination. However, it does not mean that the pathogen is completely eliminated. So it is very difficult. It is very difficult to eliminate, or we can say eradicate the complete pathogen from the universe. That's why the definition of elimination came into existence. That yes, we can adopt certain strategy so that the level of disease can reduce to a level which is lower than the level which is achieved by control. Isn't it? Finally, so by discussing these different definition of eradication, elimination, the scientists they came to a final conclusion that finally the eradication can be defined as the regional extinction of an infectious disease or infectious agent. It means that if an infectious agent is eradicated or it is eliminated regionally from a particular area. Okay, it is if it is absent from a particular area, then we call the disease is eradicated. So this regional extinction, it was added to the definition that yes, we cannot talk for complete extinction of disease or infectious agent from the universe or from this earth, but yes, if we can extinct or if we can remove the infectious agent regionally from a particular, say for a particular country or a particular area, then we can say that disease is eradicated. If we say that FMD is eradicated in United Kingdom, it means it doesn't mean that FMD is absent from the whole earth. It simply means that disease is not present, infectious agent is not present in United Kingdom. As you see, there are many countries which have eradicated rinderpest, and India is also one of them. So India has also eradicated rinderpest from the country. It means it is not the disease is not extinct from the entire world. So regionally, it is extinct. So we can define that eradication in a simple way as the regional extinction of an infectious disease is called as eradication. Okay? So you can learn this definition that regional extinction of infectious agent is called as eradication. And extinction I have dealt uh, this in the above definition. You can see the elimination. What does it mean? Reduction in the presence of clinical disease or infection below the level which is achieved by control. So, what are those strategies that we can take place, we can adopt in order to control and eradicate the disease? That is also important. As a as an epidemiologist or as a public health veterinarian, we should know how to go for control and eradication of disease from an animal or human population. That is important. So the first, we can say the first method or the first strategy, we can simply say doing nothing. So this is not a strict measure of disease control that doing nothing will act as a in principle act as a method of disease control. But yes, in nature, the host and the agent they may undergo certain changes that that may lead to control of a disease or prevention of a disease in the susceptible population. So, by going in certain changes in the pathogen itself or in the host itself, they develop the resistance against a disease. So, without having any interference from human being, the disease can also be controlled naturally. That is the strategy of for control of it, control and eradication of disease, or doing nothing. If you do not do anything, the disease may also get controlled itself, but it is not true with every disease. There is always a chance of spread or more transmission of disease if you do not interfere in the occurrence of disease. So another method of control and eradication we all know during this pandemic, that is the method of quarantine. So this is a simple definition of quarantine. That is, it is the isolation of infected animal or suspected animal or the animal which are at risk of infection. They are isolated. Okay. So this is not a new practice. This is a very uh, old age practice, and people used to do this practice, especially when the peoples or the animals are traveling transboundary, means from one country to another country. The peoples or the animals they are transported or exported, imported to different countries. This practice was there. That is the importing country. They used to keep the animal isolated for a certain period of time, and they they just observe that if the animal is having any type of disease, especially they observe for those diseases which are not present in the importing country, or if the country which is exporting they are having an endemic disease, some particular endemic disease, the importing country they used to observe for occurrence of those disease in the suspected animals. So it is simple isolation of infected or suspected or the animal or population at risk, that is called quarantine. And this period of quarantine it depends upon the incubation period of the infectious agent, because you know the incubation period is the period of between infection and the occurrence of clinical disease, clinical symptoms. That is called incubation period. So the agent, so that the quarantine population, they are observed or they are kept isolated for a period, and that period depends upon the incubation period of the disease or infectious agent. So it means both the things. That is the time taken to confirm the disease, or the time taken to become the animal, to become the infected animal as non-infectious. It means that that the animals which are suspected or those which are infected, both are kept isolated, and if it is suspected, they are kept for a period that is required for the confirmation of the disease. And if the animal is infected, it means the animal is, suppose the animal is diseased and it was kept for quarantine, so it will be kept in quarantine till a period, then the animal become non-infectious. That is the period of quarantine. So that is very important to understand. As you see in the present scenario of COVID-19, you see the people traveling from abroad, they are being quarantined for a period of 7 to 14 days, depending upon the incubation period or depending upon the government strategy. So the people who are having confirmed cases of disease, they are they are isolated, they are quarantined till the human or the patient become non-infectious. So that was the uh, basic principle or the idea of uh, making the animal or human quarantine. Another strategy was to slaughter the animal. So this method is also adopted in many of the countries where the infected animals or diseased animal, they are slaughtered. And this was although supposed to be the most important method of just just a minute. I'm sorry. So, slaughter of infected animal in order to control a disease is also known as a stamping out policy. If you have any animal which is having a infectious disease, go for its slaughter. So Western countries, they used to adopt this policy in order to remove many diseases from their herd, like in certain, like in case of brucellosis, in case of FMD, in case of bovine spongiform encephalopathy. Western country, they used to isolate the infected animal and go for its slaughter. That policy is called stamping out. This is the best policy to remove disease from a population. Although in our case, that is in case of Indian condition, we cannot go for this policy because of certain restriction. And also the problem is the economics also. If we have a high number of population having infected with a particular disease, we cannot go for its slaughter because of economical reason. So, although this is a very effective tool, but many countries they do not go for such type of strategy. So the next important strategy is the vaccination. As we know, this is the most important method of preventing a disease, or we can go for eradication of disease from animal population or human population. And this method is highly effective when the disease is either in epidemic form or in pandemic form, in order to decrease the number of susceptible animals. So it means that when a pandemic takes place or when an epidemic takes place, the our our aim or our target is to reduce the number of susceptible population so that the infectious agent cannot or should not hit their host. If we block the host, the agent transmission will be minimized or stopped. So that is the basic principle behind the vaccination. More and more we vaccinate, the lesser number of hosts are available for the infectious agent. That is the meaning of herd immunization also. That we are nowadays we are daily listening these things that we go for maximum number of vaccination to COVID-19. That is, we are trying to reduce the susceptible population so that the infection can be minimized. That is our strategy. So another method of we can go for a control of disease is by doing therapeutic and prophylactic chemotherapy. So this method of using certain chemotherapeutic agent, like we can go for use of antibiotics and helminthics or any particular type of uh, therapeutic agent in order to control the disease. So there are many diseases in which we can go for prophylactic use of certain drugs also. And although this is not done in every case, but in some case, the prophylactic use of antibiotics in the animal husbandry practice also, because we want to have a higher productivity in animal, we can we are using those antibiotic as a prophylactic measure of control of certain diseases in the population. So that is a strategy that can be used, and this strategy, prophylactic chemotherapeutic agent, they are used as a therapeutic agent. That is for the treatment of disease. These agents are also used. Another strategy is movement of host. So this particular strategy of moving the host from endemic area or risk area may help in the control of certain, say, parasitic disease, especially. So this type of strategy is practiced in some tropical countries where the host, they are seasonally moved from the area from an area when the biological vectors they are active. Say in case of in some tropical country like in rainy seasons or in summer seasons, the host the animals they are moved from that particular natural habitat, or you can say the natural place of the host to different area, so that the disease or the biological vectors which are active in their natural area, they cannot transmit the disease. So this movement of uh, host from a high risk area to low risk area is also practiced in order to have a control on in order to control the disease. The next strategy we can adopt is the you can say mixed or alternate or sequential grazing method. So this type of grazing method, mixed grazing or sequential grazing method, they are adopted especially in control of parasitic diseases. So uh, we see that mixed grazing is it means that susceptible and resistant animal populations they are mixed together during grazing. So by mixing, we can reduce the level of contamination in the pasteurization, especially against the helminthic parasites. The idea is to we can reduce the pasture contamination by enforcing resistant animal in that pasture, so that the parasite whatsoever is present on the pasture, if it is I mean engulfed by resistant host, the parasite will not survive. So that will reduce the level of contamination in the pasture. Or we can go for alternate grazing. Alternate grazing, it means that the pasture, the grazing of pasture with different species of animal. Okay, so we can allow the grazing of sheep followed by cattle. Okay, it means there is a species-wise rotation. We allow cattle, we allow alternatively sheep or goat, so that they have different parasite specificity. So the parasite which can infect goats, they are consumed by the cattle, and the parasite which infect cattle, they are consumed by the goat. So by doing this alternate grazing, we can go for a significant level of control or reduction in the pasture contamination. So that is the strategy which has been used nowadays in many uh, farming of animals. There is also a method of sequential grazing. So sequential grazing means different type of means grazing of animal at different time of resistant and susceptible population of the same species. So we can have in a population we can have susceptible animal, we can have resistant animal. So if we allow the sequential grazing of resistant and susceptible animal, this strategy is called sequential grazing. It means within the species we allow sequentially to graze the pasture by a resistant animal and a susceptible. Okay, so this will also lead to reduction in the partial contamination. So by practicing such type of animal husbandry practices in animals, we can control up to significant level of the disease, particularly of helminthic type of parasites. So that is very important. Another method is control of biological vectors, because we all know that biological vectors are the vectors which allow the agents to grow inside them. So if we control those vectors, we can control the infectious agent. So controlling biological vector is also a method of controlling disease. We can use insecticide, we can use pesticides, we can use some, biological uh, pesticides also, so that we can go for control of biological vector. Similarly, we can go for control of mechanical vectors, because mechanical vector we know that although they do not help in the growth and multiplication of the organism inside them, but they can carry they can transmit the agent from one animal to another animal. So if we go for control of those type of vectors also by using pesticide, insecticides, we can control the disease in a population. Fomite disinfection. So those infections which can be transmitted through non-living surfaces like some food surfaces, some iron surfaces, or any fomite bond which are non-living things. So if we disinfect, sanitize those fomites, we can check or we can control the disease in a population. So that's why the use of hygiene and sanitation came into existence. If we sanitize the surfaces where we touches, this will reduce in the level of disease or infection. So this fomite disinfection is also a method of control strategy for infectious diseases. Another method is niche feeding. As we know that every organism they have a particular location where they attaches and multiply. So this is the principle by which if an area is occupied by some other organism, that area will not be free for a pathogenic organism to attach. So that is the niche feeding. Already filled area cannot be shared by some other organisms also. That's why the use of probiotics it came into existence, or slow dose feeding of non-pathogenic bacteria to the animals. This will also help in the control of disease. If your intestinal tract is full of healthy, or you can say healthy bacteria, the pathogenic organism cannot attach to your GI tract, and that's how you will be having a better health. You will not have a disease like salmonellosis. So this is a concept where wish feeling is adopted. Many times we may see that in some piggery industry or in some poultry farming, the natural vaccination concept is there. It means the animals they feed their crops, their fecal material in lower doses. It helps in the prevention of many diseases because of misfeeding. The intestinal tract is full of non-pathogenic bacteria. So pathogenic bacteria they cannot attach themselves to the host. That's how it helps in the prevention of disease. And that is also a method of control and eradication of certain disease, not for all diseases, but certain disease, yes, it is used. Then another method is improvement in the environment. Animal husbandry practices, feeding of animal. This is all known. If we go for hygienic environment, we can we can control many diseases like many bacterial diseases, many viral diseases can be controlled if you have a good environment. If you have a clean environment, you have a good animal husbandry practices. If you are having good feeding practices in animal, that's how you can go for it for control of these diseases. Then another method is genetic improvement of animal. That is very important nowadays. People they are going for genetic selection of animal. So the animal which are genetically resistant to particular disease, they are selected. They are allowed for breeding. Like our indigenous cattle, they are many they're resistant for so many type of diseases compared to exotic animals. So by genetically selecting high producing animal and also those who are resistant to many diseases can be a strategy to eliminate or to control a disease in animal population. This is very, although this is difficult to have genetic improvement of in human beings, but in animals this is possible, and the people they are going for it. They are going for a genetically resistant animal against a particular disease. Like in case of brucellosis, there are certain genetic marker which are available, and the those animals which are having those markers, they are selected and bred so that they can have a resistant population. If you have a resistant population, the disease occurrence will be automatically very low. That is the beauty, or you can say that is the importance of genetic selection, genetic improvement of animal. Then the last method is the minimal disease method. So by this method, it is the combined effort of treatment, prevention, sanitation of farm premises to minimize the disease. So if you have an intensive farming system in your in an area in a country, the farm should be clean. They should maintain sanitation. They should go for preventive strategies. That is vaccinating the animal against different types of disease. And if disease happened in that herd, they should go for treatment of the disease. So by adopting these treatment, prevention, sanitation, and all practices at a time in a farm premises, you can minimize the occurrence of disease. And if you minimize the disease occurrence, it will ultimately lead to control of disease. So the chances of occurring disease can be minimized by combined effort of treatment, prevention, and sanitation, so that the disease can be controlled or eradicated. So that is the strategy which are being adopted in many farm at many farm levels for the control of disease. So that is the motto. Okay, so in nutshell, we have finished this topic. If you have any query, we can ask.
Sir,